Tansei, good afternoon. Thank you for joining us today and for the opportunity to share our work on Métis health research and data governance. I'm speaking to you from the homeland of the Métis and Treaty 4 territory. My name is Marg Friesen, and I have Adele Panahi, the Director of Health for Métis Nation Saskatchewan, here with me. I'm the Minister responsible for health for the government of Métis Nation Saskatchewan. Métis Nation Saskatchewan is the government representing Métis citizens in the province, and our health department advocates for the improved health and well-being outcomes and improved healthcare services for Métis citizens across the province. It's important to frame the conversation by acknowledging the legacies of colonization. The impacts of past and present colonial policies with respect to Métis people are often not well understood or addressed. Métis are distinct Indigenous people with unique health needs which require specific attention. The past and ongoing legacy of colonization, including oppressive system policies such as the loss of land, residential school experience, 60 scoop, federal and provincial jurisdictional battles, and systemic racism have all played a significant role in the lives of Métis people. Root causes of poor health outcomes suffered by Métis people, such as intergenerational trauma caused by colonial policies and adversity in childhood experiences. As a result, Indigenous people face poorer health outcomes than the general Canadian population. One of the major barriers to achieving health equity is the significant gap in Métis-specific healthcare data in Saskatchewan because Métis are not identified in the current healthcare system. In order to decolonize Métis health and well-being policies and practices, we must first understand Métis concepts and definition of health, which often differ from Western concepts of health. These include self-determination, health is holistic and multifaceted, and health is land-based or place-based. These concepts must remain at the forefront of all the work we do as a nation and with our partners. The United Nations Declaration on the Rights of Indigenous People, or UNDRIP, affirms Indigenous rights to self-determination, self-government, and non-discrimination, and it's integral to the relationship between Canada and the Métis Nation. The Canada-Métis Nation Accord also enforces UNDRIP, as well as the government-to-government relationship that we have, recognizing the Métis Nation as a distinct Indigenous nation with inherent rights, including rights to health and wellness. Métis Nation Saskatchewan is working with the Saskatchewan government and health agencies to identify and access Métis-specific health data in their records through our citizenship registry. Access to Métis-specific health data will allow us to identify the health profiles of Métis populations and know where to prioritize our health promotion efforts to close the gap of health inequities among Métis peoples. In many ways, we're still on a journey to ensure Métis peoples are identified, respected, and adequately served. In 2019, Métis Nation Saskatchewan signed a Métis government recognition and self-government agreement with Canada, outlining a pathway for the Métis Nation in Saskatchewan based on our distinct culture and inherent rights of the Canadian Constitution, Section 35, specifically, to address inequities related to the social and economic barriers Métis people have been experiencing for many generations. The Métis health research and data governance principles emerged out of a partnership between Métis Nation Saskatchewan, Dr. Caroline Tate, a team of researchers from the University of Saskatchewan and the Saskatchewan Health Authority. The partnership created a framework for researchers and health agencies to promote equity in health and well-being for Métis people, which are supported by UNDRIP and the Canada Métis Nation Accord. The project was funded by the Canadian Institute of Health Research and supported by the Saskatchewan Network Environment for Indigenous Health Research, or the NEIHR Centre.
So for Métis Nation Saskatchewan, decolonizing policy begins with respecting our Métis self-determined health research and data governance principles. These principles include, as you can see here, honoring Métis self-determination over health research, data and policy, including ownership, control, access, and stewardship of research and data. Building reciprocal relationships through the meaningful and authentic engagement of research partners, respect for individual and collective autonomy, identity, personal values, gender, confidentiality, practices, and protocols across the research and knowledge mobilization process, safe and inclusive environments that are culturally safe, and include different Métis voices and perspectives across the work of the research partnership, as well as all geographic and social context. Also recognizing the diversity of Métis perspectives and lived experiences that can influence the design of the research relationship and their processes. In addition to that, research should be relevant to Métis people who are involved in it, requiring community partners to identify research topic that Métis wants to undertake, have input into the design of the project and co-design the project and participate in the project's activities at all stages of the research. Métis context is important as well. Métis context requires researchers to be familiar with the history of Métis people, Métis government, specifically to local history and community or organization they are conducting research with. And finally, stewardship of the data requires a clear legal statement and agreement to ensure that Métis Nation retains its data sovereignty over research processes, data analysis and storage and knowledge mobilization, even if the data is stored and protected by an external partner.
The Métis have often been referred to as the forgotten people for many reasons, including being vigorously pushed to the margins of society by previous Canadian governments. But it's important to note that discriminatory colonial practices still prevail. Métis people have been left out of existing federal Indigenous specific healthcare policies and programs. Jurisdictional disputes often exclude Métis people from both mainstream and Indigenous specific healthcare systems. While First Nation and Inuit access some of their programming through the First Nations and Inuit Health Branch of Indigenous Services Canada, the branch does not have a mandate to provide enhanced health support for Métis people. So Métis must access mainstream provincial services that often do not meet the specific healthcare, cultural, or geographical needs of Métis peoples. However, Métis Nation Saskatchewan has been working with Indigenous Service Canada to include Métis specific health services in their mandate. This is an ongoing discussion with the Government of Canada. In many ways, we are still on a journey to ensure Métis peoples are identified, respected, and adequately served.
So since we don't have access to health administrative data in Saskatchewan, we started going to our communities and consulting with our people in their communities to understand the needs of our Métis communities. We engaged with more than 800 citizens over the past few years and asked about their experience using the healthcare system. This engagement provided us with a rich and in-depth understanding of Métis social determinants of health, challenges they face, and successful models of care and ideas that they have for improving healthcare system. As a result of these sessions, we have created culturally safe and relevant health support programs to support our Métis citizens and promote health equity in health and well-being for Métis, in collaboration with other Métis Nation Saskatchewan ministries, such as housing, This includes medical travel assistant program that we introduced during the pandemic, and we cover the cost of fuel, food, and accommodation for those patients who travel for their cancer appointments or dialysis appointment or general medical appointments that they have. We also created a holistic Métis specific mental health and addiction helpline, where our intake officers, they take the client and refer them to Métis mental health providers in Saskatchewan. We also created a holistic Métis elder care. In some region, it's going on, you know, some of our regions are providing that services to our elder, but in provincial level, we are still looking for some funding to start this project and cover the cost of, you know, medications and health equipment for our Métis elders. And also there are other programs such as housing programs for first-time home buyers or home repair through housing department. These programs are addressing health from a Métis perspective, and they are filling in the gaps that exist in our current healthcare system. We will continue to work alongside our advocacy and partnership with the provincial and federal government to ensure there is a long-term and committed funding for Métis citizens to build relevant, respectful, and self-determined Métis-specific health and research surveillance project. As a result of this engagement and partnership with Cancer Agency, we were successful in entering into data sharing agreement with Cancer Agency, so we now have access to our Métis-specific data in Saskatchewan.
And in closing, I would like to acknowledge our partners, the Mamawiikikayaahk Health Research Network and Dr. Caroline Tate and her research team, as well as the Canadian Institute of Health Research for funding this work. Merci.